All right, so so your spine is kind of like an unbalanced seesaw. If you have an adult and a kid, right? If the adult slides over far enough, it can balance off the seesaw. Well, that's exactly what your spine is, right? Because the spine's at the back. So for every pound that you're overweight here, it puts an extra 5 over here. So 10 pounds converts to 50 and so on. So that can really add up. If you're 20 or 30 pounds, you may be talking about 150, 200 pounds on that low back, causing back pain, degeneration, disc herniations. So the good news is, though, is if you can lose 10 pounds, right? Well, now you've taken 50 off of your low back, and even that can make a big difference. So how are we going to get this weight off? Well, there's 4 steps. One is we got to get the low impact exercise. Now, since your back is hurting you so bad, and so on, as I was saying, the best thing that I could think of is something like this recumbent bike, okay? So you get on this thing, pedal, 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 for at least 30 minutes. And if you could do it even twice a day for 60 minutes, that's going to get your endorphins going, which are your powerful painkillers. So then we can hopefully get you off the hydrocodone. And then it's also going to increase your metabolism. Every time you exercise, it increases your metabolism for 24 or 48 hours. It's not just while you're exercising. Most people don't realize that. So you're like burning more gas all the time. Let's say if you had your car in the driveway and you want to burn up a tank of gas. If it's just sitting there idling, it's going to take forever, all right? Whereas if you're driving it around, or if you just put a brick on the accelerator, right, then it's going to burn the gas a lot quicker. So the exercise is key. Plus it exercises your back muscles so they're getting stronger. The second thing is use a good scale and check your weight every morning after you pee. There's an app called Lose It that we like to use. There's other ones. But in Lose It, you just track your weight. So you're at 311 now. We'll plug that in. And then we'll plug in, our goal weight we said was going to lose 30 pounds, okay? So we're going to take it down 30 pounds and then 2 pounds per week, okay? That's our goal, which is pretty much very, very doable, okay? So that gets into Lose It. Every morning you hold yourself accountable. You get on the scale, you put it in there, and you're going to see that graph starting to go down. It's going to be like, I'm going to do it, and I'll actually tell you the date that you're going to hit your goal. Okay? It's very encouraging, okay? Now the third thing is the diet. Dr. Hayes' simple approach to this, put up 2 fingers, you both do this. Everybody has fingers, most of my patients have fingers, okay? So you want to focus on eating 2 types of food. The index finger represents protein foods. This is meat, fish, cheese, eggs. Got it? Or protein shakes. That's your index finger. This finger, green vegetables. Okay, so this is how simple it is. So for breakfast, you can have a 3-egg omelet with cheese and spinach, okay? And you can have a cup of coffee and some water, but no fruit, no orange juice, no bread, no cereal. Just eggs, cheese, and maybe some spinach in your omelet, okay? That's what I had. Delicious. For lunch, how about some grilled chicken on a salad with oil and vinegar? And then for dinner, as we say here, you could have a big honkin' steak with green beans and a nice big salad.
Asparagus.
So asparagus, that would be great.
Okay.
But no potatoes, no pasta, and no bread, okay? So I like to focus on the foods that you do eat, okay? So you're not starving to death. You're just eating the way people used to eat 500 years ago. It's just in the last 100 years that we've poisoned ourselves with all the carbs. If you do keep your carbs that low, your carbs are going to be down around 20 grams a day. And if you are, then you're going to be definitely in fat burn or ketosis, okay? And so then you're going to really lose the weight, okay? And that's going to have some other benefits that we're going to talk about. And the fourth thing is this diet will tend to make you a bit constipated. Firstly, during the first week or two, you're already having some constipation from your narcotic, right? So you definitely want to take some psyllium husk fiber tablets and if you need to be, some Miralax, okay? And if you don't poop after 3 or 4 days, take Miralax.
Sure.
The benefit of doing this, there's 4 big things that end up working together. Number 1, you get your endorphins working. That's your natural painkiller. That's your body's morphine. Why do people get hooked on narcotics? Because we already have narcotics in there. Why do those crazy people have the 26.2 on the back of their car and they're doing triathlons? They're addicted to endorphins, okay? And I hate them because they're all super athletic. But the problem is they're really just addicted to endorphins. Your endorphin level right now is very low, all right? So that's going to help you. The second thing is all that exercise is going to help you strengthen the back muscles, which is going to help. But then look at this, the weight loss. Every pound you lose is going to take 5 pounds off of your aching back. But guess what? You've already had a knee replacement, right? Guess what? It takes 6 pounds off of your knees. So it may help save that other knee, okay? And look at this. The low carb diet also has an anti-inflammatory effect. All right, so it decreases inflammation. You already have rheumatoid. It decreases inflammation all over your body. I have a little bit of arthritis in my knee. I have some in my back and some in my hand. If I eat one high carb meal, my hand hurts, my knee hurts, my back hurts. It's that simple. So we get all four of these things working together, and what does it do? Reduces your pain. All right, so we've had patients that have lost 10 pounds, 20 pounds, 30 pounds, 40 pounds, up to 120 pounds, okay? It's all on this sheet. The question is, it's breaking the habit. So how do we do it? The first thing you do is when you go home, you walk around your kitchen and you look through those fingers, okay? So you go around the kitchen and you see a big loaf of bread, okay? Get rid of it. It's poison, okay? If you see any sugary stuff, get rid of it. It's poison for you. And it can cause diabetes. You can reverse diabetes, by the way, with this diet. And this is a healthy diet for both of you. When you go to the grocery store, okay? If either when you go to the grocery store, do you guys bring your hands with you to the grocery store, usually? Okay, both of you? So when you go to the grocery store, because you're probably buying for him, look through those two fingers first before you put it in the cart. And if it ain't one of these, and it ain't one of these, don't buy it. You're wasting your money. Now, if you drink alcohol, a little bit of alcohol is okay, but try to stay away from the beers and stuff because they have a lot more carbs in it. All right? All this can make you feel better. It also makes your brain work better. So you avoid this thing called grain brain. So you actually think quicker, your energy level is better, and you're actually less likely to get Alzheimer's and other issues. So there's lots and lots of health benefits because this is the diet that God meant us to run on, but a lot of us have gone away from it. Now, if you start to get too thin, which I'm not too worried about right now, but you start to get get down to your ideal body weight, then you can start to introduce some healthy carbs, like a little bit of whole grain rice or a little bit of fruit, okay? But until you get there, and I never seem to get there because I end up cheating and whatever. So but you definitely want to stay away from fruits as well.